I'm Marlys Johnson, and here's advice that I would give to the caregivers of a man with prostate cancer. The best advice I could give is to encourage that patient, that prostate cancer patient, to talk. And don't bully him, don't nag him, but as time goes by, encourage him to talk, because as Gary mentioned earlier, prostate cancer affects your manhood, and a lot of that he just kept inside of him, wanting to be the strong man that he is. And one of the problems we had, my aging mother was living with us for about 4.5 years during this time that Gary was diagnosed, and we were both working full time. We came home from work. My mother was there. We would cook dinner, fall into bed exhausted. I had needs to take care of with my mother that we just didn't have or didn't take the time to talk about all that Gary was feeling like we should have. And for me to reassure him that he is the most successful man that I know. He was just feeling like a failure as a man. And for me to reassure him over and over in terms of all the things that are most important, in terms of our marriage, our family, our children, our grandchildren, he's the most successful man that I know.
Some prostate cancers are high risk, aggressive, and more likely to spread. Others are low risk, least likely to have bad outcomes. The biopsy says cancer, but current diagnostic tools provide limited information about how aggressive a man's individual disease is. So most men decide to treat prostate cancer immediately. Once treated, many men experience serious long-term side effects, like incontinence and sexual impotence. Immediate treatment isn't always needed, but right now a man can't be sure if his cancer is the kind that is likely to require treatment or if he's okay to wait for now. What if there was a test that could determine how aggressive prostate cancer is? Genomic Health is developing a new test to do just that. By reviewing the underlying biology of the tumor and using genes from multiple biologic pathways, the test can predict the aggressiveness of prostate cancer when diagnosed, allowing a man to make a more informed treatment decision with confidence, taking care of himself with more information and greater peace of mind.